for us at the Capitol. I want to bring in Republican Congressman Tom Cole of Oklahoma, who voted for last week's health care bill in the House. Congressman, good to see you. Thank you for joining us again.
Good to see you.
I want to run you a clip. I bet you've heard this. Your colleague, Raul Labrador, at a town hall on Friday, went viral over the weekend. Listen with me.
You are mandating people on Medicaid except dying. You are making America...
No one wants anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
I don't understand. I mean, that's a strange statement to make. Nobody dies because of access to health care. What's your take on this?
Well, I think, frankly, he was misunderstood and, frankly, misspoke, and I have a lot of sympathy having done that myself. I think the basic point, as I understand he was trying to make, is, look, under the law, you're entitled to get health care at any hospital without whether you can pay for it or not. You still have to treat patients, and I think that's the point that he was trying to make. Right.
He went and characterized it as emergency care, but a lot of people who die for lack of health care don't require an emergency room. You know, it's people are in palliative care. If you don't have health care, you can't get that. You can die of a cancer. You can die of a whole lot of things that don't ever require you to go to a hospital and need emergency care, but you need long-term care.
Well, look, I certainly agree with that. But again, I think some of the rhetoric here has gotten over the top. And, you know, when it makes about as much sense to accuse Republicans of wanting people to die as it did of accusing Democrats, which some of our people did, of running death panels. I mean, I think the rhetoric here sort of gets in the way of trying to get to the problem in an efficient way. And hopefully we can get past that.
Well, I appreciate you always coming on to talk to us and get past that. The Senate working group that I was just talking to Mike Vaccaro about, they're talking about Medicaid. Now, we don't have a new score for the new bill, which is a troubling matter on its own. But based on the old bill, the CBO estimated that it would cut $839 billion over 10 years to Medicaid, and they projected by 2026 about 14 million fewer people would be enrolled in the program. How do you reconcile that? You're in a state where people benefit from Medicaid. There are some hospitals that are open only because most people who go to those hospitals are paid for by Medicaid.
We're in a different situation in a lot of states. Look, we're not a Medicaid expansion state. We're one of the 19 states that's not. So really Medicaid, as it exists here, will basically be fine. If you're in a Medicaid expansion state, you know, that's another consideration. We just simply don't have that. But I think the real question is, can you deliver, you know, quality care, affordable care at a you know, a rate that we can actually afford as a country? And I can make an argument, you know, pretty strongly. In my state, look, we're down to a single provider. That provider, God bless them, is losing money, and they're still in the market. And frankly, we're going to have a 69% rate increase. And because we're not a Medicaid expansion state, our hospitals are treating a class of patients that, frankly, in other states are getting reimbursement for. So, frankly, the Republican bill is a better bill for us because there's money for hospital, there's tax credits for individuals, and there's a chance to get other people back into the market. But again, I'm like you. I'm very interested in seeing what the Senate does, and I'm glad they're focused on this. Had we not passed a bill in the House, they would not have been. I've cautioned everybody all the way along. Look, this is going to be very different. The Senate's going to come up with something different. Then we'll do, hopefully, what the Constitution requires. We'll go to conference and see if we can work out those differences, come up with a plan that's better for the American people.
So, Congressman, I guess one of the issues, of course, is my complaint as a financial guy is there was no CBO score. So I'd find it, if I were in your position, hard to vote one way or the other without it. Most people didn't even read the bill. Did you read the bill?
I did, because frankly it's so much shorter than Obamacare. You know, it's only a couple hundred pages long, and you know, that's in contrast to a 2,400-page Obamacare bill, which I assure you most people never read.
But you know that the couple hundred pages is because there are a whole lot of amendments to existing legislation in Obamacare. So to get a full understanding of it, you'd have to have read Obamacare.
Well, which I did, by the way. But regardless of that, I mean, partly it's because this is part of a much more, you know, of a process than a single event. There's still all the things that Tom Price would do. There would still be follow-on legislation. And there are parts of Obamacare that we left intact. You know, the Indian Health Care, or Indian Health Improvement Act is still intact in there. The being able to keep your kids on your insurance till they're 26 is still intact. So there's a lot of things. There's, you know, overlap. There's change, but there's continuity as well.
So, Congressman, you made a reference to hospitals or insurers losing money. I keep on making the argument that it's a perverse incentive to assume that people can make money off of either prisons or health care. Isn't it fair to start thinking about the fact that it's just not a good business?
Well, you know, I don't know that it's not a good business. Frankly, there's a lot of people in the healthcare industry that make a lot of money off of it, and American healthcare providers are generally, frankly, better compensated than healthcare providers in other parts of the world. So, you know, there is that. But it's also a very innovative business. I mean, American healthcare and certainly, frankly, pharmaceutical research, both public and private, is much more productive than any place on the planet. And a lot of the improvements that have come that have, frankly, made life better for everybody have been generated by the American healthcare system and biomedical research system.
I agree with you. I mean, it really is, like so much in America, so innovative, and yet 3 times, double to 3 times the cost of so many other developed nations. It's definitely a puzzlement we're going to have to figure out. Sir, good to talk to you as always. Thanks for joining me.
My pleasure. Thanks.
Congressman Tom